Good day, everyone. Today, we will be discussing records in physical therapy. This topic is part of organization and administration, but it is also highly relevant to your clinical practice. Because every treatment you perform, every patient you handle must be properly documented. Records are not just paperwork. They represent your clinical reasoning, your professional responsibility, and your accountability as a physical therapist. So, as we go through this lecture, I want you to think not just as students, but as future clinicians who will document real patients. Let us go through each point on the slide. First, records integrate all aspects of physical therapy practice. This means that documentation connects everything we do from evaluation to treatment to outcomes. Second, records serve as documentation of patient care and services. In simple terms, this is where we write what we did, how the patient responded, and what our clinical decisions were. Third, records are essential for communication, decision-making, and continuity of care. This is very important because physical therapy is not done in isolation. We work with doctors, nurses, and other therapists, so our documentation helps guide future decisions and ensures that care continues properly even if another therapist takes over. And finally, records provide legal and professional accountability. This means that your documentation reflects your responsibility as a professional. If something goes wrong, your record is your evidence. So always remember, clear documentation is part of safe and effective practice. Now let's discuss the categories of records. First, clinical records. These are directly related to patient care. This includes referrals, evaluation forms, and progress notes. For example, when you assess a patient and document their range of motion, that is a clinical record. Second, administrative records. These support operations and management. This includes statistics, financial records, and personnel records. For example, tracking how many patients were treated in a day or recording staff schedules. So, in summary, clinical records focus on the patient, while administrative records focus on the system. Let us go through the importance of records. First, records ensure continuity and coordination of care. Continuity means treatment continues across sessions and providers. Coordination means all healthcare professionals are aligned. For example, if one therapist treats today and another tomorrow, documentation ensures consistency. Second, records support interdisciplinary teamwork. Physical therapists work with physicians, nurses, and other professionals. Documentation allows everyone to understand the patient's condition and plan. Third, records serve as legal documentation. They act as evidence of what was done. If documentation is incomplete, it may appear that no proper care was provided. Fourth, records serve as a basis for evaluation, planning, and reimbursement. Evaluation means assessing outcomes. Planning means guiding future treatment. Reimbursement means ensuring payment from insurance. So records are not just notes. They are essential for clinical care, teamwork, legal protection, and financial processes. Now let us move on to the uses of records. In physical therapy, records are not just written documents, they serve multiple important functions in both clinical and administrative practice. They help us communicate with other healthcare professionals, evaluate the quality of care, support education and research, and guide decision-making within the department. As we go through each use, I want you to think about how documentation is applied in real clinical situations. Because in practice, records are not just written, they are actively used to improve patient care. Now, let us discuss communication. First, records facilitate communication among healthcare team members. This allows different professionals to understand the patient's condition. Second, records ensure accurate and timely transfer of patient information. This reduces reliance on memory and prevents errors. Third, records enhance coordination of care. This ensures that treatment is consistent across providers. Clinical example: a patient with stroke is treated today by one therapist and tomorrow by another. Without proper documentation, the second therapist may not know what was done. This may lead to repetition or incorrect progression. With proper documentation, treatment continues safely. So, communication through records is essential for patient safety and effective care. Quality of care assessment is one of the most important uses of records. First, records allow evaluation of treatment outcomes. This means we can determine whether the patient is improving over time. Instead of relying on memory, we use documented data to see changes in strength, range of motion, function, or pain levels. Second, records identify strengths and weaknesses in care delivery. By reviewing documentation, we can recognize patterns. For example, if several patients are progressing slowly, this may indicate that the current intervention needs to be modified. It helps us reflect on our clinical decisions. Third, records support quality improvement programs. This allows departments to improve overall performance. Data from records can be analyzed to enhance treatment protocols and improve patient outcomes. Example: documentation consistently shows that a specific intervention produces better results. That approach can be adopted as a standard method in the clinic. So overall, the records are not only tools for documentation but also tools for evaluating and improving clinical practice. Records also play a significant role in education. First, records serve as learning resources for students and staff. They provide real clinical examples that go beyond textbooks. Instead of just learning concepts, students can see how cases are managed in actual practice. Second, records bridge theory and clinical practice. They help connect what is learned in the classroom to what is applied in patient care. Students can observe how evaluation findings lead to treatment decisions. Third, records support clinical training and case analysis. They are commonly used in discussions, case presentations, and clinical conferences. Clinical example: during a case presentation, a student reviews patient records to understand the diagnosis, treatment plan, and outcomes. This process helps develop critical thinking and clinical reasoning skills. So, in summary, the records are not only used for patient care but also serve as valuable tools for learning and professional development. Research is another important use of records in physical therapy. First, records provide data for clinical research. This means that the information we document, such as patient outcomes, interventions, and responses, can be collected and analyzed. Instead of relying on assumptions, we use actual recorded data to study effectiveness. Second, records support evidence-based practice. Evidence-based practice means that treatment decisions are guided by research, clinical expertise, and patient needs. Records serve as the foundation for this process. Third, records help advance the physical therapy profession. Through research, we are able to improve treatment methods, develop new protocols, and enhance patient outcomes. Clinical example: documentation shows that a specific exercise program consistently improves mobility in patients with knee osteoarthritis. This intervention may be supported by research and adopted in clinical guidelines. So overall, the records are not only used for documentation but also contribute to knowledge, innovation, and professional growth. Records also serve as a source of motivation. First, records reinforce staff performance. When therapists document outcomes, they are able to see the results of their interventions. This creates a sense of accomplishment and encourages consistent performance. Second, records track patient progress. Patients can observe their improvement over time through measurable data such as strength, range of motion, or functional ability. Third, records encourage accountability. When documentation is required, therapists become more responsible in their treatment approach. Clinical example: the patient recovering from injury may see gradual improvement in mobility across sessions. This visible progress motivates the patient to continue therapy and motivates the therapist to maintain effective treatment strategies. So records not only track progress but also support motivation and accountability in both patients and therapists. Administrative control is another key use of records. First, records support planning and budgeting. They provide data on patient volume, types of conditions, and services provided. This helps in allocating resources effectively. Second, records help in scheduling and workload management. They show how many patients are being treated, how often, and by whom. This allows for better organization of staff and time. Third, records provide data for decision-making. Managers and administrators use records to guide operational decisions. Clinical example: if records show a high number of patients requiring orthopedic rehabilitation, the clinic may allocate more equipment or assign more therapists to that area. So, records are essential not only for patient care, but also for managing the efficiency and effectiveness of the department. Legal aspects are one of the most critical functions of records. First, records serve as legal evidence. They document what was done, how it was done, and why it was done. Second, records protect both the patient and the healthcare provider. Accurate documentation shows that proper care was given and that professional standards were followed. Third, records must be accurate, complete, and timely. Delayed or incomplete documentation can be interpreted as negligence. Example: if a patient develops complications after treatment and there is no documentation of the intervention, it may appear that no proper care was provided. However, if documentation is clear and detailed, it can demonstrate that appropriate procedures were followed. So, documentation is not just clinical, it is also your legal protection as a professional. Records are also essential for third-party requirements. First, documentation is required for insurance and reimbursement. Healthcare services often involve payment from insurance providers or other third-party payers. Second, records must justify treatment and services provided. This means documentation should clearly show the patient's condition, the need for therapy, the interventions performed, and the outcomes achieved. Third, records ensure proper billing. Incomplete or unclear documentation may result in denied claims. Example: if a therapist provides treatment but does not properly document it, the insurance company may refuse payment. So, documentation directly affects the financial aspect of healthcare services. Records also provide benefits to society. First, records contribute to the advancement of healthcare knowledge. When data is collected over time, it helps improve understanding of diseases and treatments. Second, records support public health improvements. They provide information that can guide healthcare policies and community programs. Third, records enhance the overall quality of patient care. By learning from documented cases, healthcare providers can improve future interventions. So, records go beyond individual patients. They contribute to the development of the healthcare system and benefit society as a whole. Moving into the principles of records. These principles guide how documentation should be written to ensure that it is clear, effective, and reliable. They help standardize the way information is recorded so that it can be easily understood and consistently used across different healthcare providers. Understanding these principles is important because good documentation is not just about writing, it is about writing correctly and professionally. Every record has a function and purpose. First, to notify. This means informing others about a patient's condition or status. Second, to order. Records may include instructions such as treatment plans. Third, to report. This involves documenting findings, interventions, and outcomes. Fourth, to certify. Some records confirm that a procedure or treatment was performed. Fifth, to acknowledge. This includes confirming receipt of information or services. For example, a referral form notifies the therapist, an evaluation report documents findings, and a progress note reports ongoing changes. So every record must have a clear purpose and should not contain unnecessary information. Communicability refers to how well a record can be understood. First, records must be clear. This means avoiding vague or ambiguous terms. Second, records must be concise. Only relevant information should be included. Third, records must be accurate. All data should reflect the actual condition of the patient. Fourth, records must be objective and specific. This means avoiding personal opinions and focusing on measurable findings. Example: instead of writing patient is better, it is more appropriate to write patient improved knee flexion from 90 degrees to 110 degrees. This provides clear and measurable information. Good communicability ensures that any healthcare professional can understand the record without confusion. Standardization ensures consistency in documentation, and this is a very important principle in record keeping. Let us go through each point in detail. First, standardization allows comparison of data. When records follow the same format, it becomes easier to compare patient outcomes across time and across different patients. This means that if all therapists document in a similar way, we can clearly see patterns in improvement or decline. For example, if range of motion is always recorded using the same units and the same format, it becomes easier to compare day 1 versus day 5. One patient versus another patient without standardization, comparison becomes difficult and sometimes inaccurate. Second, standardization improves reliability. Reliability means that the information recorded can be trusted and consistently interpreted. When documentation is standardized, there is less variation in how information is written. This reduces confusion and ensures that different therapists understand the same information in the same way. For example, if one therapist writes good strength and another writes 3 out of 5 muscle strength, these are not equally reliable. Standardized documentation encourages the use of measurable, objective terms. This increases accuracy and reduces subjective interpretation. Third, standardization enhances efficiency. When records follow a consistent format, healthcare providers can quickly read and understand them. There is no need to interpret different styles of documentation or search for information in different locations. This saves time, especially in busy clinical settings. For example, if all progress notes follow the same structure, such as subjective, objective, assessment, and plan, the therapist can quickly locate needed information. This improves workflow and allows more time for patient care. Now let us look at a clinical example. If all therapists in a department use the same format for progress notes, it becomes easier to review patient history, track progress, and plan future interventions. For instance, a therapist taking over a case can quickly understand what was done, how the patient responded, what the next step should be. Without standardization, documentation may vary from one therapist to another, making it harder to follow the patient's progress. So overall, standardization supports clarity because information is presented in a consistent way, consistency because all therapists follow the same format, and effective communication because records are easily understood. Standardization is not about limiting how you document. It is about ensuring that your documentation is clear, reliable, and useful for everyone involved in patient care. Form design focuses on how records are structured, and this is an important aspect of effective documentation. A well-designed form helps guide the therapist, ensures completeness, and improves efficiency in recording information. So now let us go through each point. First, avoid duplication. This means that the same information should not be repeated unnecessarily in different parts of the form. Duplication can lead to wasted time, increased workload, higher chance of inconsistency. For example, patient identification is written multiple times in different sections. There is a risk of mismatch or error. Instead, forms should be designed so that information is recorded once and used consistently throughout. Second, use clear instructions. Forms should provide clear directions on how they should be completed. This ensures that all users, whether students or experienced therapists, can fill out the form correctly. Instructions should be simple, direct, easy to follow. For example, a section labeled assessment should clearly indicate what type of information is expected. Without clear instructions, documentation may become incomplete or inconsistent. Third, ensure efficient use of space. Forms should be organized in a way that allows quick and accurate documentation. There should be enough space for writing, but not so much that the form becomes cluttered. Sections should be arranged logically. For example, patient information at the top, evaluation findings, next treatment plan afterward. This logical flow helps therapists document quickly, especially in busy clinical settings. Fourth, standardized format and terminology. Forms should use consistent layout and standardized terms. This aligns with the principle of standardization and ensures that all records are uniform. For example, using consistent headings such as Subjective Objective Assessment Plan helps all therapists understand the structure of the record. Standard terminology also reduces confusion and improves communication among healthcare providers. Now let us consider the clinical relevance. Well-designed forms save time because information is easy to enter, reduce errors because instructions are clear, improve documentation quality because all required data is captured. For example, a well-structured evaluation form ensures that no important information, such as vital signs or functional status, is missed. On the other hand, poorly designed forms can lead to missing data, confusing entries, inconsistent documentation. This can affect patient care and may even create legal risks. So overall, form design is not just about appearance. It directly affects efficiency, accuracy, and quality of documentation. A good form guides the therapist and supports clear, complete, and professional documentation. Location and ownership are important considerations. First, records must be accessible when needed. Healthcare providers should be able to retrieve records quickly. Second, records are owned by the healthcare institution. This means they are not personal property of the therapist. Third, records must be securely stored. Confidentiality must always be maintained. Example: patient records should be available during treatment sessions but protected from unauthorized access. So accessibility and security must be balanced. Focusing now on patient care records. These are the records that directly relate to patient management. They document the entire process from referral to evaluation to treatment and discharge. These records are essential because they guide clinical decisions and ensure continuity of care. Patient care records include several types, and each type serves a specific purpose in documenting the patient's care. Let us go through them one by one. First, referrals. These indicate the reason why the patient is sent for physical therapy. They usually come from a physician and may include the diagnosis, precautions, and requested interventions. This serves as the starting point of the patient's rehabilitation process. Second, evaluation forms. These document the initial findings of the therapist. This includes patient history, physical examination results, functional limitations. Evaluation forms provide the baseline, which is very important for planning treatment and measuring progress. Third, specialized forms. These are used for specific purposes such as detailed assessments, certifications, or condition-specific evaluations. For example, forms for neurological assessment or functional outcome measures. They allow more focused and detailed documentation when needed. Fourth, progress notes. These track changes over time. They document how the patient responds to treatment and whether goals are being achieved. Progress notes are updated regularly and are essential for guiding ongoing treatment decisions. Fifth, discharge summaries. These summarize the outcome of treatment. They include final patient status, goals achieved, recommendations for follow-up or home program. This marks the completion of the therapy process. So when we look at all these together, each type of record contributes to a complete picture of patient care. From referral to evaluation to treatment and finally to discharge, these records document the patient's entire journey through physical therapy. Evaluation forms contain essential patient information and they serve as the starting point of the rehabilitation process. Let us go through each component. First, patient identification. This ensures that all documentation is linked to the correct patient. It includes basic details such as name, age, and identification number. Accurate identification is very important because errors at this stage can affect all succeeding documentation. Second, date of evaluation. This establishes a clear timeline of care. It allows the therapist to track when the assessment was performed and helps in monitoring progress over time. Third, therapist signature. This confirms responsibility. It indicates who performed the evaluation and ensures accountability for the findings and decisions made. Fourth, clinical findings. This section of the evaluation form includes the results of the assessment, such as patient history of illness, range of motion, strength, functional limitations, and pain levels. These findings provide objective data which will guide treatment planning. Evaluation forms form the foundation of treatment planning. They provide the baseline information needed to set goals and select appropriate interventions. Accurate evaluation leads to appropriate intervention, while incomplete or inaccurate evaluation can lead to ineffective or inappropriate treatment. Progress notes are essential components of documentation because they reflect what happens after the initial evaluation. First, they track patient improvement. This allows monitoring of changes over time. Progress notes show whether the patient is improving, remaining the same, or declining. Second, they document treatment response. This means recording how the patient reacts to specific interventions. It includes tolerance to exercise, changes in symptoms, and functional improvements. This helps determine whether the treatment is effective. Third, they ensure continuity of care. Future sessions depend on previous documentation. Each entry provides guidance for the next treatment session, especially when different therapists are involved. Example: if a patient demonstrates improved strength over several sessions, the therapist can safely progress exercises, such as increasing resistance or complexity. On the other hand, if progress notes show pain or poor tolerance, the treatment plan can be modified accordingly. Without progress notes, treatment becomes inconsistent and clinical decision-making becomes less reliable. So progress notes are essential for safe, effective, and continuous care. The problem-oriented medical record, or POMR, is a structured and systematic approach to documentation. It organizes patient information based on identified problems. It includes 4 main components. First, database. This contains initial patient information, including history, examination findings, and baseline data. Provides the foundation for identifying problems. Second, problem list. This identifies all patient issues such as impairments, functional limitations, and participation restrictions. Each problem is clearly defined to guide focused intervention. Third, initial plan. This outlines the treatment strategies, including goals, interventions, and expected outcomes. Provides direction for managing each identified problem. Fourth, progress notes. These track ongoing changes and document how the patient responds to treatment over time. Clinical relevance. POMR promotes organized and systematic care. It helps therapists think logically and ensures that treatment is problem-focused. It also improves communication because all team members can clearly see the patient's problems and how they are being addressed. So POMR supports both clinical reasoning and structured documentation. Administrative records focus on the operational side of physical therapy services. Although they are not directly related to patient treatment, they are essential for managing the department effectively. They provide information needed for planning, coordination, and overall organization of services. Administrative records include several components that support the management of the department. First, department statistics. These track patient numbers, types of services, and frequency of treatments. They help identify trends and measure departmental performance. Second, personnel records. These include information about staff such as qualifications, schedules, attendance, and performance. They support workforce management. Third, financial records. These track income, expenses, and budgeting. They are important for maintaining financial sustainability. Fourth, equipment records. These monitor equipment use, maintenance, and condition. They help ensure that equipment is safe and functional. Together, these records support planning, management, and decision-making. They help ensure that services are delivered efficiently and resources are used effectively. Electronic data processing refers to the use of computerized systems for managing records in physical therapy. This represents a shift from traditional paper-based documentation to digital and integrated systems that support both clinical and administrative functions. First, it improves efficiency and accuracy. Digital systems reduce manual errors such as illegible handwriting, incomplete entries, or misplaced records. They also allow faster documentation because templates and predefined formats can be used. In addition, electronic systems often include prompts or required fields, which help ensure that important information is not missed. This leads to more complete and accurate records. Second, it is used for billing, scheduling, and documentation. This means that multiple processes can be handled within a single system. Clinical documentation can be recorded, while administrative tasks such as appointment scheduling and billing are managed at the same time. For example, appointments can be scheduled electronically, reducing conflicts and missed sessions. Treatment details can be documented immediately after intervention, and billing information can be generated based on those entries. This integration improves workflow and reduces duplication of work. Third, it enhances modern clinical practice. Electronic records allow easy access to patient information from different locations within the facility and, in some cases, even remotely. This improves coordination among healthcare providers. It also allows therapists to review patient history quickly before starting a session. In addition, electronic systems support data analysis. Collected data can be used to monitor patient outcomes, evaluate treatment effectiveness, and support research and quality improvement. Example: a therapist is about to treat a patient who has been seen multiple times. Using an electronic system, the therapist can quickly retrieve previous evaluation results, progress notes, and treatment plans. The therapist can then update documentation in real time, immediately after the session. This ensures that information is current, accurate, and readily available for the next visit. Another example: if a patient misses an appointment, the system can automatically track attendance and assist in rescheduling. This improves patient management and overall clinic efficiency. So overall, electronic data processing is essential in modern healthcare because it improves accuracy by reducing errors, accessibility by allowing quick retrieval of information, and efficiency by integrating multiple processes. Electronic systems do not replace clinical judgment, but they support better documentation, better organization, and better delivery of patient care. This slide summarizes the key points of our discussion on records in physical therapy. First, types of records. We have clinical records, which are directly related to patient care, including referrals, evaluation forms, and progress notes. We also have administrative records, which support operations such as statistics, personnel, and financial records. Second, key uses of records. Records are essential for communication and coordination of care, ensuring that all healthcare providers are aligned. They are also used for quality assessment and improvement by evaluating treatment outcomes and identifying areas for enhancement. In addition, records support education and research by providing real clinical data for learning and evidence-based practice. Finally, records serve for legal protection and reimbursement, ensuring proper documentation for accountability and for financial processes. So overall, records are not just documentation, they are essential tools that support safe, effective, and professional physical therapy practice. This slide highlights the remaining key concepts in documentation. First, principles of good documentation. Documentation should always be clear, accurate, concise, and objective. It should follow standardized formats, use well-designed forms, and be accessible when needed, while still maintaining confidentiality and security. Second, patient care documentation flow. Documentation follows a structured process from referral to evaluation to progress notes and finally to discharge. This may also include structured systems like the problem-oriented medical record, which helps organize patient information logically. Third, administrative and modern systems. Documentation also supports planning, budgeting, and overall management. In addition, electronic data processing improves efficiency, accuracy, and accessibility of records in modern clinical practice. To conclude, documentation is an essential part of physical therapy practice and reflects your competence as a future professional. For our next meeting, April 7, a long quiz is expected. This will cover the previous topic on equipment, utilities, and communication systems, as well as this lecture. So please take time to review and prepare. You will also see these topics again in your midterm examination. Coverage has already been posted in the Facebook group chat, so kindly check for your guidance. Thank you, and I will see you on our midterm exam on April 14th at 10 a.m.